Come again. So we have already seen some of the basic features of this software. In this video, we will see how all the different functions, different different parts of a hospital work together to give a integrated view for a patient. So if you remember last time, we have created a patient called Tom Cruise. Let's just search this guy. And you can see there is a Tom Cruise. And with this patient, we admitted him to a particular bed. And there was some basic details we entered. And also we had entered some observation, vitals. We can also enter some physical equipments, which basically physical assessment and equipments. So for example, if ventilator is being used, we can, or oxygen pump, or similar way we can add more equipment and they will appear here. So all these things can be entered. Consultation we have seen, and we have seen that in current treatment the doctor has identified it's dengue and has recommended one test and the medicine to be given. Now in this video we'll see how these things are integrated together, and immediately as soon as the doctor has given this medicine and test, how they appear immediately in the lab. So let's first go to the lab module. Now in order to go to the lab module, you have to click here, lab, and you will see the lab. And in lab you can see that there's a to-do list, and you can see in the to-do list there is Tom Cruise, and there's a button for collect sample. Have you collected the sample? So as soon as you have collected the sample, this particular status is changed. So it has become to update result. And now we can see here, just refresh it and see if the status is updated here. You can see the sample collected status has been updated. Now we again do update result, and when we update result, I am going to enter some number, let's say 12, and all okay. So once I do this, you can see that the status will be updated here. You see, and you can click on this to see the report. So the report will appear. Of course, this report can be customized, but you can see the data that we entered there appears here, as well as the remarks. So all these the lab module is integrated, and as soon as in the patient module, once you have entered the detail, not only the status is updated here, you can go and view the report from here and share it in the PDF format to anyone. Similarly, the medicines that the doctor recommended, paracetamol, now you can go to the module called pharmacy, and once you click on the pharmacy, you will see here. So we are in the pharmacy, and you can see this patient and if doctor has recommended anything to him. And you can see the paracetamol is actually appears here with amount and text. Now text is something that is optional. You can turn it off, or you can change it from here as well. Now as soon as you save it, now if you see, all of these has test as well as pharmacy has some financial implication, and we'll see how they all come together in the module accounts. So you can click on open link in new tab, and let's see how the sales invoice gets generated for this gentleman, Tom Cruise. You can see here, and this is visible. The bed, as soon as allotted, the amount is visible here. The test and the medicine all are integrated together in one final bill. Not only that, in addition, you can also, when blood is required for a particular patient, it can be added from here, and again the charges are saved accordingly. Same thing happens for the food. So for example, if you want to any food that is consumed, like veg food, again the some amount, let's say 100 rupees, and you save it, and it does appear in the, and you can see everything, all this appears in the invoice. You can see everything that we have added has been added. So this is how the entire invoice gets integrated together, and every charges that is there are transparent and gets reflected instantly as soon as the different modules, be it as soon as the bed is allotted, the test is done, medicine is given, or the blood or the food is consumed by the patient. So this was the large video which essentially explains about the integration, the deep, tight integration that allows a proper communication between different departments of a hospital can be done with this software. Thank you so much for watching. Do give your feedback.